Hello everyone, my name is Dr. Michael Arias and I'm the Chief Resident for the Larkin South Community Hospital Physical Medicine and Rehabilitation Residency Program for 2024 to 2025. Welcome to Miami, Florida. We'll show you around our various rehabilitation clinics, hospitals, and departments, and hopefully be of help as you apply to PM&R residency. We are Integrative Spine and Sports. It's where we see all of our outpatient musculoskeletal patients. It's actually the private practice of our program director, Dr. Diaz. In this clinic, we offer a lot of modalities such as heat and stimulation therapy, osteopathic manipulative treatments, ultrasound-guided steroid injections, aspirations, trigger point injections, and the services of multiple board-certified acupuncturists on site as well. There's also a physical therapy room for patients to undergo PT in the outpatient setting. This is the resident workroom on the first floor of the clinic where we write all of our notes and talk with visiting medical students who are auditioning for our program. And on the second floor of the clinic, we conduct our didactics every third week. If not at this location in Fort Lauderdale, we'll often be at the Larkin GME Auditorium on the South Miami campus, or virtually. We've adopted a hybrid virtual didactics schedule since COVID. Our outpatient musculoskeletal clinic, Integrative Spine and Sports, is actually located a few steps away from beautiful Fort Lauderdale Beach. I walked here from the clinic. It's an amazing day to spend an afternoon after seeing patients just relaxing by the water. Our program is very family-friendly with access to hundreds of beautiful South Florida beaches, world-class museums and restaurants, and always something fun to do on your weekends or days off. And we do have a lot of golden weekends built into our curriculum. Sometimes even on work days or journal club days to let traffic die down on my commute back to Miramar, on average a 30 to 40 minute drive from all of our different locations, I'll run by the coast or play basketball at the world-famous Fort Lauderdale South Beach Park. And the weather is great too. Although our advanced PM&R residency program is affiliated under the name of Larkin South Community Hospital, not to be confused with our sister program, Larkin Palm Springs, we're actually hardly ever at Larkin Hospital proper, except for 6 weeks in PGY2 year when we see Larkin post-op hip and knee patients after their surgeries. Instead, we complete most of our rotations at a myriad of different rehabilitation clinics and hospitals located all throughout the South Florida area. Let's turn it to my co-chief residents to talk a little bit about more of those locations now.
Hey everyone, my name is Mihir. I'm one of the chief residents. I'm going to be talking a little bit about our VA rotation and our EMG rotation, where we work with two fabulous attendings, Dr. Romero and Dr. Fishman. Dr. Romero was trained at NYU and then did ultrasound training at the Mayo Clinic, and then Dr. Fishman also trained at NYU and then did a fellowship in interventional spine with the Florida Spine Institute. Here we get a lot of exposure with EMGs. Right now, during our PGY3 year, we're here every week. We're learning the fundamentals of EMG, proper placement, and basically getting comfortable learning about all the pathologies and kind of what it means. And this carries forward during our PGY4 year when we're stationed at the VA for 4 months in West Palm Beach, and we start to do a lot of our procedures during that time. Kind of gets us feeling comfortable with all the procedures. One of the other things that we have opportunities to do as we go into our PGY3 and PGY4 year is do a pain elective. One is associated with our ACGME Pain Fellowship with Dr. Mohana's office at the Miami Pain and Diagnostic Center in South Miami, Florida, where we get a breadth of exposure to interventional pain procedures and work directly alongside the fellows. During our 4th year, when we're at the VA, we actually have housing provided to us. It's a 2-level home that we get to stay at, a nice community, close proximity to the VA itself.
On the inpatient side of things, we spent a lot of our PGY2 and PGY3 years at West Gables Rehabilitation Hospital, a state-of-the-art facility located near Coral Gables, Florida. Some of the equipment we have at our disposal here include the C-Mill by Meltech, an advanced treadmill, and the XOX of Skeleton, all of which allow us to help recovering patients in their gait training. But what really makes working at West Gables enjoyable is the wonderful people that work here, including not only the therapists but also the nurses and our attending faculty. There are several private doctor's lounges for us to work on all of our notes and orders on the EMR, which is epic, and free food and parking is provided to all of the residents. Patients and staff alike seem to really enjoy all of the beautiful equipment, including the state-of-the-art return and driver's training and the private suites afforded to many of the patients on the 3rd floor. Here you can see some of the nursing stations and the traumatic brain injury wing where we treat all of our concussion and brain injury patients. And outside in the beautiful corridor, while some of the patients are participating in Tai Chi or garden therapy, attendings will often host weekly academic lectures. Inpatient rotations throughout PGY2 year are not just limited to the acute setting, however, as we also rotate at Waterford Nursing and Rehabilitation Center, a skilled nursing facility that was recently renovated. Nearby, you'll find the first of two Catholic Health Services hospitals in which we rotate through our PGY2 and PGY3 year, St. Catherine's West Rehabilitation Hospital. This was personally my favorite 3-month rotation of PGY2 year, as we had another private physician's lounge, fabulous attendings, and a wonderful staff that allowed us to make a difference in the stroke, spinal cord injury, and brain injury patient populations of Hialeah, Florida. And moving up the Turnpike or I-95 to Lauderdale Lakes, we have the North Campus of Catholic Health Services, St. Anthony's Rehabilitation Hospital. This inpatient rehab facility offers aquatic therapy and many of the other same amenities seen at St. Catherine's West during our PGY2 year, except we rotate at St. Anthony's during PGY3 instead. As such, we are granted an appropriate escalation in our independence as training senior rehabilitation physicians on this rotation. So not only do we work more closely with physical therapy, but also occupational therapy, speech therapy, respiratory therapy, and case management as we lead all team conferences during this rotation. It is a wonderful leadership experience as we prepare to become independent rehab physicians. At the same time, we allow our patients to regain their independence and return back to their lives from before the hospital. Now let's head back to the South Florida Spine and Sports Specialist Clinic at the Miramar Medical Center to talk about our academics.
When we're fourth years, we have an opportunity to rotate inpatient pediatrics at Nationwide Children's in Ohio, and it's affiliated with Ohio State University. Get a breadth of exposure into that pediatric rehab.
Academically, we've had a very successful fellowship match rate. About half of our residents go on to pursue fellowship after graduating Larkin PM&R residency. In the past 4 years alone, we've had alumni match into MedStar Georgetown for cancer rehabilitation, Rutgers for pediatric rehabilitation, and a multitude of pain fellowship matches, including our graduating chief resident this year going on to the University of Michigan. If it's research that you're looking for, Larkin South has a research fellow to help us get published as well. I became a first author on a case report published in the Sage Medical Journal of Open Case Reports after performing a bedside epidural in an inpatient rehabilitation setting to help manage STI-related spasticity at West Gables Rehabilitation Hospital during my neuro rehab rotation with Dr. Kester Ned, former team physician for the University of Miami football team. I'd like to reiterate that we have a very favorable resident work schedule with a multitude of golden weekends scattered throughout the entirety of our training. In fact, I was able to complete my last 2 years of Army Reserve duty as a PGY2 and PGY3 in this program, despite my Army unit being located in Los Angeles. Our program is definitely very military friendly, with our program director having served in the Air Force previously as well. Speaking of our program director, here's some closing thoughts from Dr. Diaz now.
Thank you for your interest in our program. Any questions you may have, please feel free to reach out to us. Thank you.
Thank you all for your time in considering our program. Whether you match with us at Larkin South Community Hospital Physical Medicine and Rehabilitation Advanced Residency Program or any other PM&R program in the country, we wanted to wish you the best of luck as you embark your next chapter of life in the best specialty in medicine. Cheers.